welcome to the Pause It podcast. This is Dr. Sam, and with me, Dr. Robert. How are you?
Hey, Sam, how you doing today?
I'm doing great. I'm, it was my day off, so once again, running around like crazy, which is what I do on Thursdays. So there you go.
Well, your boss of myBalto was kind of a dick, making you do all these things on your day off. So sorry about that. But you're always helping out with
that I love doing, so I don't really mind doing it at all. And then I get to chat with you, so then it's even better.
Best part of my night, honestly, is the time I get to relax. Like I'm sending out emails all day, and I'm like, thank God I have the podcast tonight because for those of you that don't know, Sam and I usually vent for like 15, 20 minutes before the podcast starts, and then we're like, all right, now let's go.
All right, I guess we need to do the podcast now.
Now let's talk. So that's how our day usually starts. So it's a nice way for me to get ready for a wonderful evening with you fine folk.
Oh yes, right. Before we have our next meeting, which we have after this. So there you go.
Yep. So that's our night, guys.
Get no excited. Rest for the weary. But you know what? It's all worth it because hopefully we'll be saving pets' lives one by one hospital by hospital, one pet owner. It'll just little by little, we do what we can.
Exactly. We're very excited to have it. So, but
well, one other thing we can do, I was gonna say is talk about. I stepped right on it. Sorry. So we thought maybe we would touch on a topic that I think is a really good thing to talk about. With antibiotics. So we're going to kind of have a discussion about antibiotics today because I don't know about you. I'm guessing in your world, you have people coming in asking for antibiotics all the time. And I can tell you, I for sure do. I have people calling on the phone. Hey, can you just fill that thing you filled last time? Oh, I know what's going on. I don't even need to see you. Just go ahead and fill this drug for me. And I think people think antibiotics are just like no big deal. And they don't really understand why we're like, I think they think we're withholding sometimes.
Yes, I would 100% agree because I think there's so many conditions that seem so obvious for antibiotics, but just due to our experience and what we know, it's not always practical. And there's been a lot of great information, especially over the last, I'd say even over the last 5 years, but even 10 years ago. I remember when you and I first started practicing, like antibiotics were used differently even as soon as 7 years ago. And now I think the last couple of years has changed very significantly. So I think this is a great one to talk about because it comes up all the time.
Oh yeah. And I think even for me, like sometimes even changing the length of time that I would have used antibiotics feels so like, oh, am I doing the right? Like, I'm going to follow the evidence. Like I'm going to do what they say. But you have these habits that you form from like seeing things, from beginning, middle to end. Again, something that you probably don't get to do that much, right? I mean, you start the treatment, but you usually don't see a lot of follow through except for your specialty patients.
No, yeah, 100%. I mean, it's kind of a nice thing sometimes, but I trust them to go back to see you afterwards and be like, hey, did it resolve? Or, anything from, pneumonia in their chest, which they'll usually be on antibiotics for, or especially like urinary tract infections. Those are all big ones for having them come back and follow up with you guys because I don't see them afterwards. So hopefully they listen. I don't know.
I think when things get better, about 50% do.
Yeah, that's true. So yeah, it's definitely a common issue. And I think it's, I think some of the information, I think that what you said about the distance or the amount of time that we put them on it for has changed. That's like, I think urinary ones are like the big ones for me. I think I used to put them on like 7 to 10 days worth of like when I first started. And then like Reese Evans is like, yeah, you only need antibiotics for like 5 days and they have urinary tract infections. I was like, it seems so short.
Yeah.
I don't know how comfortable I feel with this.
I'm sorry, I haven't gone quite that short yet, but like I'll do 7 days like that, for me. I mean, so I work with doctors that do 2 weeks.
Oh, wow. Yeah,
and I don't do that.
No, because I was shocked when I heard about it in a conference once. It's like one of those yearly, you have to keep up on your antibiotic resistance information. And they're like, yeah, the new recommendations are like 4 to 5 days for urinary tract infections. I was like, I'm sorry, what? I was like, oh, this makes me so uncomfortable. But it's worked so far.
Yeah. I think it also depends on, I think it depends on the situation. It depends on what the urine looked like. And I think it also depends on which drug you're using.
Yeah.
That's the other 100%. Thing too. What bugs are in your area too. I mean, I feel like, there are certain ones that there is a lot of evidence for just, you really don't need any more than, a week is probably max and then you're good. I'll say there are times where I'll do 7 to 10 days. It just really depends on the time, but I never longer than that. And certainly not 2 weeks.
Yeah. Honestly, there's very few things I'll go above 10 days for. And maybe respiratory bugs, like pneumonia.
Oh,
That's
I
probably the
mean,
one exception.
I'm talking about urinary tract
Oh yeah,
infections.
yeah, yeah, yeah. Then yeah, no,
I
I get
think
it.
I think so many of these things also depend on, I mean, it's like you kind of got to like go back to like, okay, well, what are we talking about here? Because I think there are a few things that people automatically want antibiotics for. So like you said,
Yeah.
upper respiratory infections. I mean,
Yep.
every single person whose dog comes back from a kennel, coughs one time, calls me and is like, they need antibiotics, they have kennel cough. And I'm like, they
Yep.
will not be getting antibiotics.
Nope.
Certainly not. Just like if you go to your own doctor because you have what seems like upper respiratory symptoms, I mean, they will make you wait 10 days at least before you get antibiotics. It's not even a question.
Yeah, and I think the good reasons for mentioning that is because if it is a dog, kennel cough in most cases is self-limiting, which means it will resolve on its own. You do
And
not need
mild,
antibiotics for it.
right?
Yep, exactly, and mild,
Yeah.
exactly. So you don't need it. And then if you're a cat, most of them are viral, so they will not respond to antibiotics in the first place unless they like a secondary bacterial infection. So a lot of these common conditions that we see all the time for respiratory causes don't really need antibiotics, and it's tough because it's always the toughest for like the small kittens
Yeah.
because they just came into a shelter environment or out of one,
Yeah.
and they're like breathing really hard, and you're like, or they're open mouth breathing, but like they're okay. They just got a snotty nose, and you feel bad, and just and if they persist for a long time, then sometimes they'll throw them on antibiotics at that point. But
I would say if it, depending on their age, depending on the signs, and if they're not eating, I'm a lot more aggressive if they're not eating. If there's
yeah,
like, I think a lot of these things break down to what are like the secondary things that are going on with them.
mhm.
Because most of the cats that I see have seeded a secondary bacterial infection. I'm pretty sure. You know what I
And
mean? Just
I
by
100% agree
those,
with you.
yeah.
Yeah, that's 100%. Yeah, I'm on board with that because and even dogs like when they do transition to like a pneumonia, that's like
Mhm.
usually when they've stopped eating or they develop a fever at home.
Exactly.
Those are the ones I'm
Exactly.
like, all right, that's time for antibiotics or rechecking chest X-rays and
Oh
so
yeah.
forth because that's when. So yeah, I agree. It depends on the patient how they're doing clinically, but usually for like the one that bounces into your room and still eating like happy as a clam, a lot of times they
Those
don't need antibiotics.
Oh, 100%. Those people call and I'm like, "Okay, are they still eating, drinking, acting like totally normally, they just cough?" "Yes." "Okay, call me
Cool.
in a few days."
Yep.
Like, that's how I'm like, if that changes, if any of those things change, let me know. Obviously, keep them home, don't take them to doggy daycare, and we definitely do have a discussion. What do you tell people, is the time frame before they can be around other dogs? Because it is definitely something that they can pass
4
along
weeks. I say it's about a full month.
before they
So
can go back to anything.
yeah.
But do you usually caution people to be completely like no more cough whatsoever, or just from like the beginning of their signs?
I usually tell 'em, like, a week post coughing signs,
Yeah, that's
at
usually
least.
what I tell people too. I try not to scare them too much with the sheer amount of time, but more so just once they've stopped having any signs, you got to wait another week.
Yeah.
And because usually those coughs persist quite a while.
Yeah, it's usually about at least about 3 weeks sometimes, and, like,
Yeah.
you always feel bad 'cause the first couple days are usually the worst,
Mm.
just that persistent. I mean, sometimes I feel like I have kennel cough nowadays. I forget, have you felt like as you've gotten older, your coughs last longer? And it's like, I felt like when I was a kid, they lasted maybe like, I don't know, 4 or 5 days, and you'd be right as rain afterwards. But now I feel like I have a cough for like the last 3 weeks, and
Oh
it's
my gosh.
like,
Well, viral coughs do. I mean, they can last for
yeah,
weeks on end. And
yeah,
so yeah, it's the same thing for our dogs. And I can't tell you how many people I have like that have just they are literally look at me like I have 18 heads when I don't want to just hand them. And the craziest thing is we have shelter, no, I guess it's a rescue around here that
mhm.
sends every animal home on doxycycline.
So not great. Wouldn't be my first choice.
I
Um,
mean, it's like not even a first like it's crazy to me. And I get so mad every time I see it. And thankfully I've had a lot of people that are like, I never gave this. Like, do I need to give this? I'm like, no. Is your dog even coughing? Like, no, don't do that. But they
yeah,
must know that they have some mycoplasm or some bug that they deal with. But it's crazy to me. And like that and metronidazole. I mean, they send everything home with doxy and metronidazole. And I'm like, what are you doing?
yeah, and I think so that's a really good one to talk about too, metronidazole.
Hmm.
Typically give metronidazole for dogs having diarrhea,
Yeah.
and I I don't know where it came from. I guess maybe just because
It
veterinarians used to give
works.
it.
I'm gonna tell
Oh
you,
yeah,
it works. That's
it
where it
works.
came from.
It works great, but like
Yeah.
I try and draw parallels from like human medicine.
Hmm.
And it's not like I go to, I mean, I guess I've never gone to the doctor for human medicine and be like, I have diarrhea. Help me out. Like, it's not a thing. And also, that's a word for people as well. When you bring your pets in, your dog's having diarrhea, it's mild, they're still eating. You don't need to see me probably, just change their diet. But regardless, that thought that you need to give antibiotics for diarrhea feels counterintuitive most of the time for me because you're destroying the natural healthy biome of their GI tract. You're killing everything, which is great, but not leaving any of the good stuff behind. And that's been shown enough now in human medicine that like you need healthy bacteria, and antibiotics, whether it's for your GI tract or for other parts of your body, can really mess up like a lot of long-term side effects. So it's kind of, I don't know. I'm glad we're making a transition as an industry a little more
Yeah,
towards
it is a
probiotics and stuff.
slow transition though, I will say, because I think that some people who have just seen it work and
Mhm.
just want happy clients. And I have had those conversations with people where I'm like, look, like, I, yeah, I understand. Like, I'm like, are they making it outside? Yeah. Are they having diarrhea all over your house? No. Are they happy running around? Like, just let's try a diet change first. Let's try some, some fiber, let's some psyllium husks. Let's try some probiotics. And
Psyllium
some
husk is
people will go
great.
on the ride with me, but some people will just be like, no, I want metronidazole because they've been given
Yeah.
it by so many other veterinarians that I'm like, I mean, if I mean, like there's other veterinarians that will just hand it out. Like,
Yeah, I guess I've had an easier time maybe in California. Maybe it's a different market as well. Like everybody out here is like, I want unprocessed food. I want natural. I
I
want
want
home cooked.
probiotics.
I want probiotics. I'm like,
I want
great. I'm
psyllium
gonna give.
husks.
Yeah, right. I mean, psyllium
Yeah.
husk is great. I mean, you're the one that told me about that. And
Yeah.
honestly, you guys can't see him right now, but Loki's right here with me, and he had that when he had some diarrhea, and it
Yeah.
worked like a dream. So, highly recommend it. It's natural and healthy for your dog's GI tract. But
Well,
it's
I
a
was
common
just at a conference. Well, it was just, I guess it wasn't that, I mean, now it's a few months ago, but when I was at Western States, that the GI, one of the GI lectures that I went to, literally, I mean, she was like, okay, so for all of those cases that once upon a time we'd all be like, oh, grab the metronidazole, or even those times where you're like, hey, let's do a bland diet and try some probiotics. She's like, try to do fiber, and that's where the psyllium husks came from. And really, it's not that novel of an idea if you have ever had people tell you that they're giving their dog pumpkin. I mean,
yeah.
that's where that came from. It's just that psyllium husks, there's the same amount of fiber that's in like I think it's 2 cups of pumpkin is equal to like a tablespoon of psyllium husks or
Oh,
some very like, I don't, maybe that might not be exactly it, but it's very close. And it's like you get so much more benefit from a time, and it's so easy to find. It's everywhere. They have it at Walmart. They have it at Whole
yep.
Foods. I mean, literally, it's everywhere. And it's basically Metamucil. It's
Yeah.
just Metamucil is, usually has sugar or some kind of flavor in it, and so the
Yeah.
psyllium
Yeah.
husks don't.
No, I think it's so. I think it's great. I recommend it now all the time after talking to you, and I've seen owners really come back and said great things about it. Like they come back for other reasons, but they said great things about it.
Yeah.
So yeah, I think it's a nice way that the industry's moving, but I think it's getting the pet owners on board with it now
Yeah.
is a tougher trial. And again, metronidazole works. I have nothing against it. I just haven't honestly I haven't used it in maybe given up 3 times this year, and I see dogs with diarrhea like every night.
Hmm.
I use probiotics all the time now, and they all do pretty well unless they all go into their RDVM or primary vet afterwards. And like this guy doesn't know what he's doing. Like into metronidazole, so who knows? But
I bet you probably what happens is there's that handful that just isn't getting better or is having an accident all over the house. Like I would assume that would be the ones that are coming back to their own vet, unless they've already just they have them on speed dial and they just get metronidazole whenever they want. But those people
yeah,
probably would have asked you for some.
I've had people ask me for it, and I'll be like, no, I'm gonna, then I focus on the education part.
Yeah.
Like, here's the reason we're doing these things. Like, probiotics are better for your dog system, and in combination with the psyllium, honestly, the previously to using like psyllium, it'd be like, hey, about 3 to 5 days for diarrhea to resolve. So like, expect it, get ready for it. Your next 72 hours are gonna suck. I'm sorry, but that's the way it is. But with psyllium, honestly, and probiotics, that's been my tag team combo, and it's worked really well
I
so
think
far.
it
I think
works great. It's what I
yeah.
would do. I mean, I would be very reticent to be just like throwing my dog on metronidazole. And I think most of the time people who do it just really don't realize what they're doing. And how many times have you heard people be like, "Well, I just gave one and it got better the next day." And I'm like, "That's because it was gonna get better." and you
Yeah,
just didn't have to give anything.
it's exactly, honestly, I'm glad you mentioned that because that's such a powerful point. What was it? Causation is not, or
Yes.
there's a term for it. Uh,
Correlation does not equal causation.
Thank you. That's what I wanted. Thank you for being the smart one in the group. Um, my brain's fried. I was like, there's a
I was gonna say,
saying
you
that
were
goes with this.
traveling today. You were on a plane. If I was on a plane today, I don't think I would have been able to just think of
Oh,
that one off the top of my head.
no, well, I appreciate you tag team effort. So, but yeah, I think it's a great point, honestly, because I think so many people walk in like, oh, I did this one time, or I'm like, that doesn't mean it worked. It's just that it was gonna get better anyway. A
Yeah,
lot
I
of
mean,
times
it
it does.
has it does have an immunomodulatory effect, and it also
Mhm.
does have some anti-inflammatory effects, which
Yeah.
we both know. I mean, I'm not going to say that it had nothing to do with it, but probably it was just going to get better on its own.
Yep. I agree. So, but great drug though. Otherwise, it's a great drug. Like we use it a lot in like septic patients that are having blowout diarrhea. So
Well,
it's
and I mean, I have dogs that are just shedding Giardia, like puppies, you know what I
oh
mean?
yeah.
And that I would say, I mean, we see a ton of Giardia and they are symptomatic. Like if they're not symptomatic, I'll just use Panacure. But if they are symptomatic, then I'm going to use both. You know what I mean? To kind of try to clear that Giardia. Now, I will tell you, I've had ones that like if they're an adult and they don't have they're asymptomatic and they have Giardia, I won't even treat it because it'll some dogs just have it in their normal flora and
Yeah.
if they're not symptomatic, it's everywhere, it's in the environment, you're not it's you so I mean you'd be deworming them like all the time, so I don't
No, that's right. I mean, I haven't done a fecal on Loki in probably 8 years. I probably should do it. I'm the worst.
probably.
I was like, he's fine. His stools are
But he is
fine.
asymptomatic. Wait, but when he had diarrhea you didn't do a fecal on him?
I've not done a fecal, even
He
for
had
my clients.
diarrhea. I can't believe you didn't do a fecal on him.
But I gave him probiotics and psyllium and he got better. So like it's like I guess we don't do fecals on ER. Like we just like, and honestly, owners will come in like ask me like, I'm
That's
gonna put
really
your dog.
surprising because I mean, how many times? I mean, like we all the time have dogs that have some kind of a failure of prevention, or they got into something and they had like. I'm surprised that you don't.
And maybe this is a fault in my medicine. This is a good thing for me to learn about. I literally had an owner. Okay, fun story time. I had an owner a couple months ago, or maybe it was close to a year ago now. Their dog came in for diarrhea. They had a middle-aged dog, so it was like 5 or 6 years old, and like they had a clear evidence of like dietary indiscretion, like they got into
Yeah.
something and like something like that. And we have discharges that are pre-made that say, "Hey, your dog had diarrhea. These are the potential causes." So I made the discharges, sent them home with probiotics. And when I sent them home, they actually wrote me a really bad review that my hospital actually contacted me about because of like, we read through all the differentials for why my dog can have diarrhea and you didn't do a fecal. And my hospital's like, why? Like, and they know ER doesn't do fecal. That's not something we do. Like, I
Right.
think none of my colleagues do. And so I had to call the owners back and say, I'm sorry, I don't think it was clinically warranted in your pet. And I had to give them a free fecal. So they came back in, we did a fecal, negative.
Negative.
Just as a point, just as a point. Sometimes we know what we're doing.
Man, what though? What if it hadn't been negative?
Then I'd be not telling the story. No, I'm just kidding. No, I'm just kidding. No, and honestly, that's what's humbling. Sometimes you learn things and we don't know everything. And who knows, half a dozen patients that could have been positive. And but yeah, we just don't run a lot
I'm just
on.
surprised too, because like even just looking for like, Giardia or something like that. I mean, it can cause
Yeah,
diarrhea. I mean,
yeah,
it is hard. I know we've learned a lot more about Giardia in even just like you said, the past like 7 years. You never would have heard me say that it could be part of a dog's GI
no,
flora when we graduated from vet school, but that is new information, and it's amazing how much is out there and how much less we as humans have to worry about it. I think part of also where the metronidazole thing came from, truthfully, is because way back, like when I was first a tech, and I think even before we went to vet school, there was the idea that Giardia, I mean, it's a zoonotic disease. People can get Giardia, but
yeah,
it's very unlikely for you to get it from your pet because there's something different about like the Giardia that they have. I don't really remember all the ins and outs of it, but I remember being
yeah,
like, oh, wow, okay, that's surprising. And so I
mhm,
do think that because I remember like dogs that would get Giardia when and I was a tech, so I wasn't a doctor at that point, but I do remember they would flagell, which is metronidazole, everything,
yeah,
because it was like, well, you got to treat it, you got to get rid of it because now everybody in the house is going to have it and the baby's going to have it, and you know what I mean, and like
mhm,
that risk and that fear is not really what we thought it was,
yeah,
as evidence changes, as we learn more. and this is all based on studies, this is based on like actual like scientific information that's come to light over time.
Yeah.
And
No,
probably people saw the diarrhea stop, is my guess. And that's where the metronidazole came from.
yep. And like I said, it works. It's a great drug. Just we're trying to be conscientious of antibiotic resistance as we move forward. Um, I think probably one of the other big areas that, well, I guess what's another body system, I guess, that you feel like
Oh,
requires
dentistry
antibiotics?
for
Oh,
sure. For sure,
yes.
dentistry.
So I'm
Dentistry and
curious about that
surgery
one.
just in general. I'm going to put that out there. I
Yeah.
think that there was a huge, like there was a time, even when I first started doing dentals, where we would do prophylactic antibiotics. I mean, everybody would get clindamycin because there was
Yeah.
this idea that we were somehow going to protect the dog from septicemia when we were disrupting that biofilm of just, absolute disease and
Yeah.
bacteria in the mouth. But it turns out that I mean, that is exactly what it is. It's a biofilm. And
Mm.
like just like we learned from the teeth gas that we had. Um,
Yes.
but the fact of the matter is dogs that have like severe dental disease, every time they eat, they shower their body with bacteria.
Yeah.
Literally every time they do anything, they move, they eat, they chew, that happens. And so it's not actually that much more of a risk. The only time now that I believe there's any um recommendation to prophylactically use antibiotics
Mm.
in conjunction with dentistry is if they have a heart murmur, or if they have like a TPLO repair where they have an implant, so the chance that
Oh, okay.
that could become infected, or
Makes
if
sense.
they have existing I believe kidney disease as well. I mean, I think there are some
Makes
times
sense.
where there's right. And so that, that sort of a thing. But yeah, just throwing everybody on antibiotics is definitely not recommended. And certainly once the teeth are done, I mean, I did have one the other day that had an abscess. So
Oh, yeah.
that's different because there's blood flow
Yeah.
to that.
Exactly.
When you have an abscess, there's actual blood flow. So the amount of antibiotic that you're doing can get to a blood level to actually do something about it. Whereas
Mhm.
if you just have dental disease, there is no way that you can take into your body orally enough antibiotic to get to a level that would fight that bacteria that's
Yeah.
in
Yeah.
that biofilm. It just
Yeah.
won't do it. It's the same way with like ear infections in dogs. We treat them generally topically when they're external ear infections because oral antibiotics just won't reach the levels to get it unless it's an internal or a middle ear infection.
Yeah, exactly. I think that's the big thing to emphasize. Like, there's a reason we try and do topical antibiotics
Hmm.
sometimes because you're actually treating the source of where it's an issue. Because stuff on the outside, you're not gonna get very well with antibiotics because of that reduced blood
Right.
flow.
Now there
Um,
is a subset of otitis externa that is a little bit like deeper that does need antibiotics, but that's the exception to the rule. That's not the rule. That's for sure.
we're gonna talk about that afterwards between you and I because I have no idea which 'cause I don't do it. That's why I don't do ear infections. So I was like, "Hey, Sam, update me on that
It's
afterwards."
that's usually like when you have a failure of one to actually respond
Oh, okay.
properly.
Makes me
That's
feel better.
usually
Okay.
when I'll throw that in there and say, I wonder if there's a middle ear component to this, but they don't have it so
Yeah.
bad that they have like a neurologic sign that they have an
Oh, I see what you're
internal.
saying. Okay.
So there's otitis interna, otitis media, and otitis externa, and
Yes.
externa is by far the most common one.
Mhm.
And that's the one we treat most often. But every once in a while, you get those ones that don't really make any sense why they didn't get better. And your cytologies, you did them, you treated them properly.
Yeah.
Everything short of maybe culturing them, which we'll certainly do sometimes.
Yeah. That's a no, that's a really good point because I can't I don't treat enough ear infections. That's part of the reason, unless they're like vestibular or shaking when they come in to see me in the first place, and that's or
I treat
tilted.
so many ear infections.
That's why I can't do general practice, and really appreciate all my colleagues that do because I just can't do it. I just ear infections. I don't know why I got a problem with them. I think it's just in my head now after years. So I don't know.
Maybe, I don't know. I actually love cleaning ears. Like I really love
Yeah,
doing it. Of
you would. It's
course. Yeah. I mean,
so
usually like when a dog has like really, really gross ears, I will just be sitting in there like having my conversation with the owner, just like
it's
getting
just
that stuff out. It's like, let me
therapy. This
show
is
you what's in
therapy.
your dog's ear. It's great. Because at the end of it, you're like, I did some good here. Like I know it's going to get better now because I just took all this stuff out of there. And then we'll put the
Exactly.
good stuff in. But getting back to the dentistry, yeah, they're definitely once you've gotten the diseased teeth out, you've
Mhm.
now gotten the source of the disease out. There is absolutely no reason that they need antibiotics. And
Yeah.
there's bacteria in your mouth. It's
Yeah.
not
No, I mean,
sterile,
it's,
and it's never going to be.
mhm. I think honestly that's a really, it's like, you just gotta get the teeth out at the end of the day. Cause, and dogs, if you haven't had a chance yet, Sam already mentioned it, listen to the Teeth podcast.
Oh my goodness,
It's,
so eye-opening and amazing.
oh God, it's also scary as all hell. So like,
Yeah.
take a listen. It's got a great bunch of information on all of that.
Hmm.
It's one of my favorite podcasts that we've done, and I think it's got such great information. So check
Oh
it
yeah, it
out.
was so, I mean, I could have just kept talking to her for like 3 hours. I
Oh
was
yeah,
like,
she's great.
you're brilliant. Wow.
Yeah,
But yeah, so but yeah, that's a huge one. And then the other one, that always kind of is a head scratcher for me is when people do, a sterile surgery and then put a dog on prophylactic antibiotics. That I don't know. I don't know. Like, I think that was just standard of care at one point in time. And
yeah,
so people came up, and just learned that way. Um, but to me, it just seems like counterintuitive. Like, we have we are scrubbing into surgery. We are sterile. There's
yep.
aseptic technique that we're handling tissue in a specific way to kind of make it less likely that we're going to have an infection. We're trying not to have our anesthesia times be crazy long. Another way
Mhm.
to make someone. So to me, it seems like, well, okay, you put them on an antibiotic, and if they get an infection, well, now that antibiotic's probably not going to even work, right? Because I mean, now you're gonna have to culture it and find what will.
Yeah, I agree. I mean, you guys use antibiotics during surgery, but not afterwards?
Yeah, so
Yeah,
we'll use like cefazolin during surgery,
yeah.
generally, like we did in school. I
Okay.
think that there's still good evidence that that makes a lot of sense to do, but the prolonging it after has been shown to increase
Resistance.
resistant infections. Yeah.
Yeah.
Hmm.
No, that's what our hospital does, and this is not to put a slide on any accidents happen. Surgical infections happen. That's just a natural
Oh
course of
yeah.
things. I will say probably in many cases it's bad luck. Sometimes it's inexperience. I'll be honest. Like there's like I don't see a lot of surgical infections with the surgeons that I work with. They're board certified and they do a very good job,
Hmm.
and they have certain protocols that they do a great job with. But most times, a lot of times, it's just bad luck. At the end of the day,
Oh
where
yeah.
this.
And I mean,
So
surgery has risks. It has
yeah,
complications. They can have dehiscence. But you're also at the end of the day talking about a dog. So if you don't follow the post-surgical instructions, then
yes,
it's actually not the surgeon's fault.
no, and that's an
Like,
awesome point to bring up
yeah.
because dogs lick their incisions all the time. They take their e-collars off, and it doesn't take that many licks. We all know they lick their ass. I'm sorry. Where do you
Oh
think that
yeah.
bacteria is still hanging out? It's still in their mouth. So start licking your incision. It's gonna be right on top
Oh,
of it.
I've cultured E. coli out of incisions before.
Oh yeah, it doesn't shock me one bit. And
Yeah.
so most of them, I guess, I mean, that's the third category. It can also be the owner's fault. So for not listening. So
I
um,
think people really have this like fear of the e-collar. Like, I really don't want to put the e-collar on them. And it's like, it's a very short period of time. If you don't want the e-collar, get a surgery suit. You know what I mean?
yeah.
Or something like that. Because I had one dog that had a cryptorchid. So it was a retained testicle. The testicle was in the abdomen. I had to go in and get it. And I did the incision on the side where, there's a little way to do it. So I didn't have to actually go into the abdomen to get it. But anyway, that little side incision that I did, that dog took his foot and just scratched it until he opened the incision and caused one heck of an infection. And I'll tell you that owner got real, like, because the girl, the people who were answering questions at first, the girls who work up front were like, "Oh, did you keep the e-collar on?" She's like, "Yeah." And they're like, "Did you really keep the e-collar on?" And she was like, "I kept the e-collar on." Like, she was like so mad because she really did. She did everything right. It just was bad luck. Like, that
Yeah.
that just happens sometimes.
Yeah, and exactly. It just happens sometimes, and it's unfortunate. But infections are very those happen, but like the frequency of infections don't warrant giving prophylactic antibiotics. I think that's kind of the point of
Well, especially because
yeah,
it's prophylactic antibiotics will not make up for poor technique. They will not
exactly,
make up for a dog licking its incision. They just
exactly.
won't.
I would say like honestly of the infections that we see. This actually I don't know. I shouldn't give a percentage because it's not based on anything but other than experience. But otherwise, like I'd say a vast majority of the infections we see are because of the things we mentioned, not because of surgical technique. It's
Mhm.
just it's unfortunate. So keep the e-collars on your dogs.
Yeah. Well, and trust your veterinarian if they don't want to just hand out antibiotics, if they're not, necessarily rushing to just fill some metronidazole for you or treat the cough, you know what I mean? Or whatever it is. And now if your dog is having any trouble breathing, if your dog is, really, really punky, lethargic, seems febrile, like, okay, those are totally different stories. We're not talking about that.
Yes.
We're talking about the happy, healthy, jumping around, blah, 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 but has like a cough, some diarrhea, or you know what I mean, fill in the blank, right?
Yeah.
And also too, one small PSA, just because a dog has a crust right here, it does not have conjunctivitis. Because I've
I've
had a lot
actually
of people want me to give them antibiotics for their dog's eye. And I'm like, but there are no other signs of conjunctivitis. It has an eye burger. That's it.
yeah,
They're like, but
yeah,
it's
we all
green. I'm like, still not warranting antibiotics. I'm sorry.
that's funny. It does happen a lot. I'm like, my dog has an eye infection. I look, I'm like,
You're like, do you
no, it
see the
doesn't.
whites of the eye? They're
Yeah,
perfectly white. I was like,
yeah,
do you
yeah,
see these things? They're doing just great. They just have
yeah.
eye
It's like,
buggers.
go home.
Yeah, yeah.
Just go home,
I mean,
dog.
I'll give them tips. I'll give them hints of things that they can do. I mean, I'll tell them, clean it off, use a nice warm rag, do a nice warm soak. Even my daughter, I'll give you this, okay? My daughter, she looked like she had pink eye. And this is a lot of times the conjunctiva in the dog's eyes are totally white and totally fine. They just have a little
Yeah.
bit of stuff there. Or maybe it's a little crustier than usual.
Mhm.
They have a little more drainage, whatever it is. My daughter's eyes looked like she had conjunctivitis. I called my sister because this is what I do. And I'm like, okay. I was like, how soon do I have to get her seen? And she was like, well, I mean, before you do that, before you worry about it, she's like, because first off, conjunctivitis, how often is that viral? Very often.
Yep.
So that's the other thing to consider. So antibiotics aren't going to do anything. But she said just do some warm soaks on her eyes and, really make sure everything's really well cleaned. And then do a warm soak in the morning, a warm soak in the afternoon, warm soak at night. By the second day, her eyes were totally back to normal. So sometimes it's not, we don't have to just rush to, oh, I got to be putting drops in my dog's eyes. I think that get them checked. Eyes can go
Mhm.
wrong very quickly. I do think eyes should be checked if you're worried, but they don't all need eye drops.
Yep. I agree. And I think a small note on the other end of the spectrum
Mhm.
would be more Eastern medicine and trying to use that to treat actual infections. Um, those I've seen a couple of those cases where people are like, oh, I'm going to rely on herbs and things that like essential oils and stuff like that to treat my dog, like clear UTI or stuff like that.
Oh, I've not had that.
Oh, I've
That's
had
California, I think.
that's California and I
Here in
sometimes
Indiana, people want drugs.
that's sometimes here they're like, oh no, don't worry, my herbalist says I can use these things. I'm like, that's not medicine. So
Never heard. I've never heard. I mean, I've never run into that.
like it happens. It doesn't happen super often, but there's even a couple of veterinarians that practice that way where they don't. I'm like,
Oh.
guys, I'm like, ooh. So balance, Eastern and Western go well together.
Mhm.
Um,
Integrative, I'm totally fine with integrative. I think that there's
100%.
a place for things that have been used to be helpful adjuncts for
Mhm.
years and years and years. I will never give a hard time to people who want to do that. But yeah, I mean, we should all be very thankful that antibiotics were found and be good stewards of antibiotics because
Yeah,
if we are not, then we will not have them forever.
yeah, and that's a scary world. So
Oh
that's kind
yeah.
of what a lot of this all this comes down to. It's the scariness of what happens when these antibiotics stop working. Um, that's that's scary to me.
Have you ever had a case where you've been like down to the last two or
Yeah,
three
there's
possibilities?
three. I think three in the last year we've had where they're like resistant to everything. Now these are dogs that
Mhm,
have been on chronic antibiotics for like multiple conditions, and we had to
mhm.
use what's the one?
I
Oh, I
had
can't
to
remember.
use Mirapenem.
That's the one. Yeah, Maripenum was the one we had to use. And I'm like, we don't ever touch it. And there's a reason we don't touch that. Cause it's kind of like
Mhm.
literally the last one you use before you're kind of like, well, this sucks. This is kind of
Now
where we're at.
we're now you're see the difference between you and I is I guess you would have the ability to put them on like antibiotics like you know what I mean like whatever I don't even use like vancomycin or anything things like that. I don't know if you can even use that in dogs but
Uh,
um
haven't seen it
But
recently.
you know what I'm saying? Like when you get into the
Mhm.
amikacin, to like some of these other things.
Yeah.
But I had a French bulldog that had so many UTIs. Same thing. I mean, she was
Mm.
old. She had IVDD, so she had some, bladder issues anyway. And she was definitely in her, you know, later stages of life. I mean, she was towards the end of her life at this point. And her owner was very, very devoted to her. I mean, really was going to do anything for her. She would go and they would do acupuncture for her back, and you know what I mean. Like she was a great owner. And this poor dog had this urinary tract infection that was just resistant to everything except for things that I couldn't give her. And
Mhm.
the last one was the imipenem, and I was like, well, I've never used this class of drug before, so I called Michigan State and
Yeah.
talked to the veterinary pharmacologist. Remember Joe? I talked to
Yeah.
Joe,
Oh, really?
and I did. I talked to Joe, and he explained to me, and I talked to Dr.
Langlois? I
Langlois.
don't
Yeah,
know that Langlois. Yeah.
yeah, I did. So first I talked to him, and then I talked to Joe about like, okay, well, if I can get this drug, how do I give it? And
Yeah.
it turns out this owner was willing to learn how, and she had to give injections for 10 days of the mirapenem. And we had to teach her how to give it, where to give it, how to draw it up, how to mix it, everything.
Yeah.
And she
It's an
did.
intense drug.
And it worked. I mean, it kicked this but man, what happens when we run out of those? I don't know. That's a problem.
That's why I think I'm glad we did this podcast. 'Cause I think it's such an important one because like all these things we're talking about is not just because we don't want to give out these medications. There is a reason for it. Because
Hmm.
one day when that day does happen, we're gonna regret using, God forbid, when Clavamox isn't accessible anymore. Like that's a scary one because that's one we use for so many things in pets.
I've
So
actually had the experience of, so you know how sometimes with Clavamox, I mean, like you'll do a culture of a urine or something like that, and it's
yeah,
sensitive to it, but it will not work still when you use it.
really,
Mhm.
yeah.
Yeah, if you
See, that's
look, actually, I didn't know. I was trying to figure out what was going on with this one specific case of mine, and I was reading about just going back and being my nerd self, and I was like, well, okay, well, it says that like I cultured it, like I did all the steps, and it's there and it's sensitive. I don't know why it didn't work.
mhm.
And so I was reading a little bit more, and yeah, sometimes it just doesn't behave in the body the way it does in the lab, which I thought was really interesting because I did not know that about Clavamox, which
Nor did
is,
I.
by the way, Augmentin. Just
Yeah,
in case people
yeah,
who don't know, it's Augmentin, but it's just a different breakdown because animals are a little more sensitive to the clavuluronic acid, and it will make them sick to their stomach. So I think the breakdown's a little bit, the clavuluronic
different.
acid's a little lower.
Yeah, and I think that's a scary point, but it's true. Like it's just things we have to keep in mind moving forward. And when those medications don't work, we're in trouble.
Yeah.
So
I mean, the antibiotic we were just talking about is a brand new class of antibiotic, actually.
mm,
So, I mean, the fact that we're already onto it is definitely a little bit scary. So just
mm,
have respect for antibiotics and understand why we're not being withholding. We're really trying to solve problems, but also be good stewards of antibiotics because we as people need them, our patients, the animals need them, and yeah, that's why there's such a big push not to have them in food animals and things like that, which is so
mm.
very important. And hopefully one of these days we'll have a production animal veterinarian on to talk about what she does. So yeah.
That'd be great. Hopefully very soon.
Yeah,
So
exactly, exactly. Well, I think this was a really fun podcast. If you ever have any questions about, what are some things you can do that are not antibiotic specific for your pets that are having any of these signs, you can always generally ask questions, not specifically, because we don't have a client-patient relationship. But general questions can go to podcast at mybalto.com.
sounds great. Well, thank you guys all for being here today. And Sam, as always, it's been a pleasure.
It's been so much fun. This has been the Pause It Podcast. Thanks so much for listening.